Good morning. Nice to see you today.
Same here. So let me leave you to it.
Thank you. Good morning, viewers, and welcome to another edition of Kakaki Cancer Awareness with Denise Ejo, the CEO of Comwood Cancer Foundation, in partnership with AIT. Together we fight, together we win. I thank you all for joining us. Let's talk about cancer. So, what are we talking about today? We're talking about bone cancer basics, understanding symptoms and the risk factors. And in the house, I've got somebody who gave his time up for me to actually do this. Dr. Sheidu. Dr. Shei, good morning.
Good morning, Dr. Ejo. Good morning.
Nice to see you.
Thanks for inviting me. Thanks for having me.
Thank you for accepting to be here with me.
Thanks.
Thank you. So let's go on. So firstly, let me just tell you can follow us on our social media handles at Comwood Cancer Foundation. Remember, we're on Instagram, Facebook, YouTube, and you can watch all our videos. So let's chat today. Let's also chat on the website if you have any questions. September giveaway is on. We've been giving away 50,000 every month since June, since Survivors Day, and it's open to anybody, family or friends. Please enter on behalf of any cancer patient you know who is willing to share their story, and it's theirs for the grabs. It's going to be open. It's going to be given up anytime this month. I don't know when. So just make sure you are following us, you are sharing, you're liking, and you're giving people a chance to do it. Good luck to whoever the winner is. We gave out the last one. They've got it. So let's start the conversation. Share, follow, and subscribe to Comwood Cancer Foundation. Dr. Shei, let me do a brief background of who you are. Dr. Shei is an orthopedic surgeon and with special interest in orthopedic oncology. He attended the Institute of Translational Medicine, University of London, where he actively participated in identification of biomarkers of sarcomas. He is also a recipient of Orthopedic Oncology Fellowship at the Royal Liverpool University Hospital and the Royal Orthopedic Hospital, Birmingham. He is a member of the Lagos That's where there was a problem. Please, can you say that word because it's too
musculoskeletal. Musculoskeletal. Yeah.
Oncology Network. And perhaps the first multidisciplinary tumor board of bone and soft tissue tumors in Nigeria. His dedication to improving the management of tumors in this area has resulted in several publications and presentations at international fora. I want to say thank you, Doc, for giving up your time to be with me this morning, and let's together share.
Thanks a lot for having me. I
appreciate. Viewers, sit back, let's have fun, and let's listen to what we need to learn about bone cancer today. Let's remain united against cancer, as together we fight, together we win. Doc, our first question. To be honest, what exactly is bone cancer, and how does it differ from other types of cancers? So that's basic.
Okay, good morning, viewers. Good morning, everyone. Cancer, as we know, is abnormal growth. That's when cells in the body begin to grow out of control. That's the simplest way just to appreciate it. There are control strategies that God or science has put in the body that controls abnormal growth. So it grows until it's needed, until when it's needed. But when this goes array, that is cancer. Now, cancer of the bone, of course, we all know that bone enhances our structure, it carries our frame. So all the bones of the body can be involved in cancer. So if it involves any of the bony tissue, then we're beginning to talk about cancer. Cancer of the bone. Now, cancer of the bone can be primary. When we call it primary, that's when it actually arises from the bone itself. De novo. That's the way the Oyibo people will call it. But what that really means is that it is arising from the bone in itself. The secondary cancers, bone cancers, are cancers that come from other soft tissues or other tissues of the body, and they're spread into the bone. Don't forget that bone supports all the tissues of the body, so they're quite close in proximity with different organs of the body. So you can have a primary cancer from the liver, from the lung, from the breast, or from the prostate gland in men, spreading to the adjacent bone or spreading into the far bone as it is. So basically that's what bone cancers mean.
Interesting. Okay, so I'm going to come off a bit now. And I'm sure I didn't ask this question, but let's go to this one. Many women with breast cancer, I'm sure you were expecting me to ask you this.
No, this
Many
is quite
women
common. Yeah.
with breast cancer that metastasizes, it metastasizes, many of them metastasize to the breast. Why is that?
Okay, you mean breast metastasized to the bone?
Okay, whichever way, I'm not.
Yeah, so it's quite common because first and foremost, breast cancer is one of the most common cancers generally.
Yes.
It's even more common in women, and it can be devastating. And one of the common areas where breast cancers metastasize, that is spread. Let's use a simple word. Where it spreads to is the bone. The bone can be the long bones, we call them the femur, which is the thigh bone, your arm bone, which is the humerus, or the spine. You don't forget that the spine supports our frame as well, the back. So it's quite common for cancers like breast cancers to metastasize to these bones and cause destruction. What cancer does generally, because they grow out of proportion, they are not able to sustain that growth, and of course the cells begin to die, which in scientific term they call necrosis. And with that you get destruction of those tissues. So the bone tissue itself can no longer, it's not strong anymore, cannot withstand the stress that you expect it to carry in terms of function as a support structure for the body. So it's quite common to have metastatic disease or spread of breast cancer or other cancers into the bony tissue.
Thank you. That makes sense. See, simple English. Sometimes a lot of us that live with this disease, you see, I won't lie, as I don't know if I've told you. I think I have. I have a breast metastatic disease. And so I really, it's one that's always bothered me. Anytime there's a bone problem, I'm like, I hope it hasn't gone to the bone. I hope it hasn't gone to the bone. So, okay. What are the most common symptoms now? This is what's going to help us now, of bone cancer that people in Nigeria should be aware of?
The simplest thing is bone pain. Then you ask me, we all get bone pain every day, isn't it? You after a hard day's work or when you do something unusual exercise, you get pain. But any bone pain that is persistent over weeks, that is, you can't explain it by any trauma or exercise, anything unusual you've done, especially when it's present in the night, should be worrisome. That sort of pain should be investigated. And when we say investigations, that you speak to a clinician, speak to a doctor, and get your doctor to do some investigations. So one of the simplest investigations is just an X-ray, just to see if there's anything happening to the bone in itself. So one, bone pain. The other thing is swelling. Abnormal swelling on any part of the body is not something that should be ignored. People should quickly seek medical intervention. That's ask for advice. Let a qualified practitioner examine you, determine whether this is the lump that you should be worried about. Because usually all over the world, there's a talk of lumps of bumps, and bumps that are more than 5 centimeters. How you get that? Maybe the size of a tennis ball, or size of a tennis ball. That's the easiest way, because if I say golf, I don't think a lot of Nigerians play golf, but the Americans and the the Europeans like to say the size, golf ball size. But the easiest way to look at it is anything that the size of a tennis ball that is bulging from your body needs aggressive investigation to be sure that it's not something that is sinister, because that is a common presentation of cancer. Other problems that you can notice include abnormal weight loss. You can't explain why you're losing weight. You start to feel generally unwell. Those are things. Really, it can cause fractures. So you can have breakage of the bone itself. Of course, that's very painful. Those are the things that you probably would indicate or suggest that there's something going on with the bone. And of course, the best way to do that is to see a doctor, get appropriate investigations, and then get referred to a specialized center that can look after you.
Okay, now we're going to come to this one. Then, so how then can individuals differentiate between the common bone-related issues like arthritis and this one and symptoms of bone cancer? Because everything you said, apart from the one about the lump, yeah, I think everybody will identify with it, whether or not you're sick. But then, how do we go from there?
So I like to keep it simple. We all hear the radio jingle every time when you buy Panadol. If symptoms does not go after so number of days, consult your doctors. So the ordinary pain that we get from aches and pain, arthritis, trauma, muscle strain, you should expect that to go within a week or so. I mean, you take in, and we all can we have access to over-the-counter medications like paracetamol. You take some painkillers for it, but this sort of pain is not going, after a few days. You should be beginning to talk to your doctor to actually get that investigated. And then, of course, by the time that is investigated and the doctor is satisfied that there's nothing more sinister, at least you have rest of mind that you've done the right thing. So that is one way to look at it. Pain that is not relenting with painkillers. That's one. Two, if it begins to become painful at night, that is worrisome. That is really worrisome. And those are the things that you need to look out for. Of course, your doctor will combine that with other questions. There may be other symptoms that you have not noticed that you didn't associate with the bone pain that you're getting. But a doctor can tie all that up and then decide whether this is abnormal or this is just a pain that is due to maybe your regular arthritis, joint ache, and not the kind of pain that's associated with cancer.
Thank you. So now, one of the first things I will say I've learned today is the fact that bone cancer is the bone pain that affects you at night. Wow.
Night pain is worrisome, yeah.
Interesting. You know, a lot of us actually do have pains at night in our bones. And we just take it as, I'm just not well, I'm tired, maybe it's the work, it's this. Forgetting that it might be something else. Okay, so how do early symptoms of bone cancer get misdiagnosed, especially in rural areas of Nigeria?
Okay, so yes, the rural area is worse, but you'll be surprised that we're still
Anywhere in
challenges.
Nigeria.
We still have a lot of challenges in the urban area. I've worked in Lagos for years, and you'll be shocked that it knows no bound in terms of level of education or social class. Or the major problem, I think, is awareness. I think there's still a lot of misinformation out there about what to look out for and what to worry about when it comes. So we are really struggling with late diagnosis with a lot of patients in Nigeria because people don't present when they should. In more organized healthcare setting, you should actually be referred to a specialist center within 2 weeks of having any of these symptoms especially if your first primary contact, your primary physician or your GP, your general practitioner, is worried that this looks more sinister than the usual kind of pain or usual kind of swelling. So the most problem that we have is a late presentation. And I think a lot of this is still due to awareness. A lot of my country people will still go to the spiritual homes rather than see a doctor. I'm not against spirituality, but of course, pastors and imams are there to pray for us all the time. But I think science still has its own role in this day and age in terms of making the right diagnosis and making sure that the treatment is started on time. So most of the problem that you have is late presentation. And of course, there are numerous factors that are responsible for that.
So this is where we have to accept that government still have a very big role to play in making sure that the awareness campaigns are taken quite seriously and maybe getting more patient advocates to support this awareness campaign as we go along. Okay.
Yeah.
Are there specific risk factors that make certain populations in Nigeria more susceptible to bone cancer?
Yeah, there are risk
Different humors
factors.
from me,
That's all right.
those words just don't work anymore.
Yeah, just keep it simple. Yeah. So there are risk factors. Like we say, nobody has been able to curb the reason why cancer actually happens. So there are a lot of research going on all over the world to stop, this dreaded disease. But every particular cancer has its own risk factors. So there are risk factors in actual fact that predisposes a certain group of people to bone cancer more than another. One is age. So one of the most common primary bone cancer is the osteosarcoma, and we have noticed that it's more common in the growing population. When I say growing population, children between their teenage years and when they're in early adulthood, and that's been associated with a numerous reasons. That's the period when a lot of the bony tissue is growing faster, because they need to get to their height, their adult height, and of course the bone cancer itself has been noticed to be more common in children who are rapidly growing, especially the taller ones. There's still a lot of research to find out why this happens, compared to other children. So age is a risk factor. Of course, the other age group is people when in their elderly population. People who have some inherent factors are more likely to have bone cancers when they are getting to the age of 60, 70, and things like that. Don't forget that cancers generally are more common in this age group because that's the age when a lot of cell disruption, what we call mutations, happen, and then you can get proliferation. So even the primary cancer, the osteosarcoma surge after the 60 years of age, but there's also the risk of metastasis that spread from other cancers of the soft tissues into the bone in the elderly population. The second thing is genetic anomalies. So there are people that unfortunately been born with inherent anomalies. There are so many syndromes, let me bore them, that affect the gene or the chromosomes instead of the control of the cell. So the control of the cell, there are certain markers that reduce the cell growth when it's such that it is proportional to what is required by the body. But when some of these factors are absent, it lets things loose. That's the simplest way to look at it. And cells have a tendency to grow out of proportion. Examples include the Leigh-Fromnin syndrome, people who have retinoblastoma gene, and so on. Another factor is people who have had previous irradiation. So if you've been exposed to radiotherapy, maybe for some treatment of conditions in the past, there's a chance that after a number of years you can actually develop what we call secondary cancers. Other factors include chemicals that have been studied in different locations of the world, but generally these are the risk factors for bone cancers generally.
Thank you. Anytime I speak to you guys, and you make me very learned. I now become very, very learned. Okay, so now I'm going to ask you. So, what role, therefore, does this genetics play in the development of bone cancer? Are there any known hereditary links, especially in Nigeria? To any, one of the things that I've learned now over the time is prostrate is a predominantly black male. In that same conversation, are there any known hereditary links?
Although there are hereditary links. Like I said, some of these syndromes run in families. If you're lucky, that's why doctors would always ask you when you're seeing them whether there's any history of cancers. So if you pick up such a history, it means that such individual need to be more closely monitored, especially if they're coming with some of the symptoms that we've discussed before. Those are the kind of people that you don't want to joke with in terms of close monitoring and aggressive investigations to be sure that we're not missing cancer at its early stages. So in actual fact, there are some inherent or hereditary problems that predisposes the individual to cancer. What this genetic defect do, like I said before, is to make that individual less able, or the tissues less able to control abnormal growth. And once you lose the ability to control abnormal growth, it means that you have a higher chance of developing cells growing out of proportion. It's not just bone cancer. These individuals may be more prone to other cancers from different tissues of the body. We've heard of so many stories in the world of famous people having prophylactic mastectomy, which is women who have elected to remove their breast, not because they've had breast cancer, but because they have that high chance of developing breast cancer because of family history. And so, wisely so, they've taken to counseling from doctors to just have that removed, so at least you reduce the chances of that significantly. So there are indeed family traits that predispose to cancer.
Oh, awesome. Yeah, thank you. Okay, so I'm going to ask you to speak to the government for us. There are three things. And one thing you will think the government should do for us? One thing. You know, when I say us, I always, I've told you.
Yeah, that includes me. I mean, we're all
It includes
Nigerians.
me. It's me. I'm talking to myself now. Okay. What the government should do for us? What the government, not the government, what contributions social groups, civic groups should do to help to reduce this? And what advice would you give to a patient now that has been diagnosed and doesn't know what to do?
So first is what government should do is better funding, better coordination, and funding comes with improved infrastructure, better remuneration for the poor healthcare workers in Nigeria who have stayed behind to pull, to make sure that the system is sustained, and of course, I've said better coordination. The second thing that you asked me is, the second question
is to do with the social groups.
The social groups, in actual fact, I must commend there's been a lot of development in terms of the advocacy in the last 10 years. My opinion, I think a lot of people, there are so many, like your foundation, for instance. I know a lot of people who have come up to support patients because I relate with patients on a daily basis. I think there's a lot that individuals are doing as a group in the country. Where I think we need to get it right is that the message needs to go to the spiritual homes. I'm sorry, because we're a very religious country, and I think we listen more to our spiritual fathers. So I think that message needs to be said in most spiritual gatherings. That look, it's good to come and worship, pray to God, and then as it is. But science has its role. And early diagnosis all over the world has been associated with very good prognosis for cancers. You'll be surprised that a lot of people who have lived with cancers for 20, 30 years, some have even forgotten that they had that diagnosis at a certain point because that was picked up very early and dealt with accordingly. In terms of advice for a newly diagnosed, are you talking about anyone that has on any of the symptoms that we've discussed? I would advise that you should please speak to a qualified medical practitioner. Let the doctor examine you thoroughly and tie up the symptoms that you're talking about. Tie it up with other questions that he may ask at his clinical examination, and then they can advise you whether you need an aggressive investigation or whether you need an urgent referral to a specialist center where you have oncologists who can deal with the condition that you have. That would be my advice.
Okay, now there was something you said that I want to pick up on when you were talking about the hold on. When you're talking about the hereditary links. No, it's not that one. It's the one that has to do with spiritual and homes, right? All this. Okay, so now I'm going to ask you, because give us a strategy. Because if I should be honest with you, it's a lot of us in this space as cancer advocates. We really like to get into those places. The doors are not open. How do we get in? Okay, go give us, as from a medical perspective, give us what you think we should do to get into those places. Because I'm not being funny, the doors are not open.
Are you talking about the specialist centers or
the spiritual homes and all the places you say we should go to go and to do the advocacy work? A lot of them are not open. No, then the door is not open. One of the things you have to remember is that because NGOs that are funded by cancer patients are the least funded, because there is already a notion that a cancer patient is already dead. So before you ask, people don't really want to put their money into an NGO that is funded by a patient, as against somebody who's an advocate. However, I always argue that we are the ones that actually have the lived experience, but it doesn't really matter. So how do we now, the same people, go to a church or a mosque and say we want to advocate?
I think you're already doing the right thing by being on this program. So I want to believe that this is being watched by so many millions of Nigerians. So amongst them will be leaders in those sectors who can be influenced with what you're doing. And I'll say, I just commend everyone who tries to reach out in terms of cancer advocacy to keep doing what they're doing, because the message will definitely get somewhere. We get to some of the leaders who can influence people and speak to them. The truth of the matter is that you may not catch everyone, you may not be able to convince everyone, but at least the population that you're reaching out to, if it keeps increasing, of course, we're building up on what we have at the moment, and then it can improve gradually. In terms of door opening, I have no advice, to be honest, in terms of extra strategy. But I believe we all belong to certain groups and communities. So what I say to people generally is, when you have the opportunity, whether it's in the family meetings, whether it's in the village meeting, whether it's in your church group, chip it in and say, look, I'm a believer. I believe in God. I'm religious, but science has its role. And one of the most advanced countries in the world, America, for God's sake, it's also that God believers. They believe in God to a large extent, but we have to be rational and practical.
I want to take this opportunity to say a very, very big thank you, because some of the things that are very important in this bone discussion, and I think we're going to have to continue to build on it, because it's not just about, this is quite a short conversation, but there's a lot more to ask, and there's a lot more conversation that's still got to come out of this. So I'm still going to come back to you and invite you to come and talk to us again at some other time. But I want to say a very big thank you to you for joining us today. Thank you for your time. I think you came back from clinic this morning, right? Yes. I came back from your thing, so you're going to go and sleep now. Thank you. I really appreciate. To our viewers, I want to say a very big thank you, and to all those who are looking for this September giveaway, go onto the Commonwealth Cancer Foundation Instagram page and go and start sharing and let people that have cancer apply for it. A lot of people that have won it can give testimonies, and we're making people actually share a video to share, yes, they've got the money, so people know that it is actually genuine. And to all our funders who have been sending us the donations to fund this campaign, I want to say on behalf of all of us, thank you. Okay, so our viewers, we'll see you again before the end of the month. I will tell you when. I just want to say thank you all. Together we fight. Together we win. Let's continue to remember we are all united against cancer, and we've got to make a difference. Follow us, and we'll see you again whenever. I don't want to say anything. Thank you all, and I'll see you soon. Our message is very clear. Together we'll fight. Together we win.